Sometimes you might have heard about osteoporosis. This is a disease affecting your bones. Osteo means bone and porosis means hollow. So that is the meaning of the word osteoporosis. And osteoporosis literally means porous. Porous means with a lot of holes. That is the meaning of the word porous. It's a disease in which density as well as the quality of the bone are reduced. Because bone is actually made up of some cement-like material, and if if the amount of cement or other material present in the bone is decreased, then the strength of the bone will be reduced. So that is the importance of, that is why bone density. So when enough, for example, if 500 grams of material is normally present, when the bone is having this disease, instead of 500 gram, maybe 250 grams may be only present. So what happens is that bone will be losing its strength. It has a higher chance of getting involving in any kind of fracture or break. So loss of bone occurs silently and progressively. This is something most people will not be noticing. Only during the old age this problem will be coming, and there are no symptoms until the first fracture occurs. So if the bone mass is reducing, bone mass is decreasing, nobody will be noticing that decrease immediately. Only during the old age that will be normally noticed. So our bones are at their most dense in the early 20s, called peak bone mass. So you are now going into the 20s. Now during the 20 to 25, your bones have a maximum bone mass. After that age of 25, your body will be gradually aging, and amount of bone mass will be slowly decreasing in your body. So when the amount of bone mass is decreasing, that will be making your bone more brittle, or have a chance of breaking or rupture or fracture. So as we age, some of our bone cells begin to dissolve bone matrix, and that process is known as a resorption, while new bone cell deposit formation or osteoid formation. So there are two processes. One is the formation of new bone cells, which we call formation of bone cell. Other is a destruction of the old bone cell, which we call the resorption. So during the time of old age, the resorption will be more instead of formation, and this is known as a remodeling. This picture is what we call, when more amount of resorption is there, we call it as remodeling. Osteoporosis causes bone to become weak and brittle. Brittle means easily breakable. That is the meaning of the word brittle. So brittle that a fall or even a mild stress, such as bending over a cow, or for example just having a cough and your bones are breaking, or you are having a bone fracture, that means you have a very severe level of osteoporosis. Osteoporosis related fractures are most commonly occur in the hip bones, wrist bones and spine. So if any of these bones are affected, it is impossible for that person to walk alone without some kind of support. And around the world, 1 in 3 women and 1 in 5 men aged 50 years and over are at the risk of osteoporotic fracture. That is a statistic. That is, women have a higher chance of osteoporosis. The most common fractures associated with the osteoporosis are fractures of the hip, spine as well as wrist. And the likelihood of these fractures occurring is also increasing with your age. And if there is any kind of vertebral fracture or hip fracture, that can make the person very much disabled, that then he will be remaining in the bed most of the time. So when you are lying in the bed most of the time, physically and mentally, that will be also deteriorating your health. The vertebral fractures can result in serious consequences, including loss of height, increased back pain and deformity. For example, some kind of fracture is happening to your vertebral column. That will be reducing your height most of the time. and you may not be able to stand also properly. So, and similarly, hip fracture often requires surgery and may result in loss of, for example, when some bones are in your hips are broken, then you cannot walk. You will be in the bed most of the time because the hip is the region that support your leg. So when hips are broken, you cannot support your legs, so that you will be on the bed most of the time. Then what is the approach for treatment? As far as the treatment is concerned, we have to change our lifestyle and we have to take a good nutrition that gives you a lot of calcium. So good nutrition and regular health are essential for keeping your bones healthy. Then being underweight increases the chance of bone loss. For example, if you are not having, for example, you should have a body weight of 55, but you are having only 45. That means you are underweight. And in such situation, your chance of getting a bone fracture is also increasing. Many men and women between the ages of 18 to 50 need 100 milligrams of calcium. And the daily amount increased to 1200 milligrams when women turns 50 and men turn 70. That means for women, osteoporosis can start at an early age, normally at an age of 50. But for a man, osteoporosis usually begin at an age of 70. Then what are the major risk factors? One is sex, already told you. If you are a female, you have a higher chance of osteoporosis. And certainly the second one is your age. Older you are, higher your chance of osteoporosis. Then race is an important. You are at greatest risk of osteoporosis if you are white or of an Asian descent. Compared to the black people from Africa, white people came from Europe, has a higher chance of osteoporosis. Then other thing is the family history. If having any parent or sibling with osteoporosis, always give you always put you in to advance higher greater risk. Then body frame size. Men and women who have a small body frame tend to have a higher risk because they might have less bones, less bone mass to draw from there. So there is also another problem. Some people have a very small body frame. They are not very big. So such people have a higher chance of osteoporosis when they get old. So that is also an important problem associated with the osteoporosis. So this is the best thing to treat osteoporosis is to take a lot of calcium rich food, do a lot of exercise so that your body remains healthy, and these are some of the things you can do to avoid osteoporosis.